Our topic is brachial plexus. So, what is brachial plexus? Brachial plexus is basically a network of nerve that supply to the upper limb. From where it originates, so it originates from the ventral rami of C5, C6, C7, C8, and T1, and they are divided into root, trunk, division, cut, and then branch. So all the root are derived from C5, C6, C7, C8, and T1. These are all root. The C5 and C6 root combine to form the upper trunk. The C7 will continue to form the middle trunk, and the C8 and T1 root will combine to form the lower trunk. Then all these trunk, upper trunk, middle trunk, and lower trunk, they continue to give two division, interior division and posterior division. You see the upper trunk also give interior division and posterior division. The middle trunk also give interior division and posterior division. The lower trunk also give interior division and posterior division. Then the interior division of all trunk, interior division of all trunk the interior division of all trunk, you see, that is the interior division of upper trunk, that is the interior division of middle trunk, and that is the interior division of lower trunk. They all combine to form the what card? Lateral card. Then the posterior division of upper trunk and middle trunk, they combine to form the posterior card, and the posterior division of lower trunk will form the medial card. This card name is given according to the auxiliary artery. According to the vesical part of auxiliary artery, that card name is given. Then we have all these card will give some branch. So the first of all we discuss lateral card. Lateral card will give three branches, which we have to learn about by a mnemonic called LML. So L will be lateral pectoral nerve, L will be M will be musculocutaneous nerve, and L will be lateral part of median nerve. So this three branch is given by the lateral card. The posterior card will give five branch, and we learn by mnemonics loner. So the posterior card will give lower subscapular nerve, upper subscapular nerve, axillary nerve, nerve to latissimus dorsi, and we have radial nerve. Then we have medial card. So medial card mnemonic is M4U. Then we have musculocutaneous nerve of arm, musculocutaneous nerve of forearm, medial part of pectoral nerve, medial part of median nerve, and we have ulnar nerve. So all these five branch are given by what card? Medial card. Then we have another some nerve. Then the upper trunk will give two branch. One branch is to the suprascapular nerve, and the second branch is to nerve to subclavius muscle. Then there is also one another nerve originated from C5, C6, and C7 root, and they will descend down and go to the they go to the serratus interior muscle. This nerve are also called nerve to serratus interior, or nerve to long thoracic nerve, or nerve of Bill. So all these nerve are also called long thoracic nerve. Then now we have discussed one major nerve. There is five major nerve, and in the muscle in the brachial plexus. One is the musculocutaneous nerve, radial nerve, axillary nerve, and ulnar nerve, and then we have other as median nerve. First of all, we have discussed about musculocutaneous nerve. Musculocutaneous nerve at root value is C5, C6, C7, and it originates from what card? It originates from the lateral card. It supplied to the interior compartment of arm. In the interior compartment, there are three muscle: bicep brachii, coracobrachii, and brachialis muscle. But this musculocutaneous nerve is supplied to the medial part of brachialis muscle, not all the brachial muscle, not all the brachialis muscle, and is also supplied to the skin of a lateral forearm, which give lateral cutaneous branch. So they supply to the skin of lateral side of forearm. Now we have other nerve is, which is auxiliary nerve. Auxiliary nerve is a at root value is C5, C6, and it originates from the posterior card. Auxiliary nerve is supplied to deltoid and teres minor muscle, and its sensory supply is skin cover the deltoid muscle. In the next video, we will explain radial nerve and ulnar nerve, and also we have explained the median nerve.